channel Gyno.
Yeah. You ever looked in the mirror and just noticed that your chest is a little different than everybody else's? And you're like, what the hell's going on? And what that is? Well, if you have those questions, then you probably have a condition called gynecomastia, which is enlarged breast tissue in men. Now, who am I? Who's the phony guy in a phony suit? My name's Jacob. I'm self-proclaimed gynecomastia expert, as I suffered with this condition for 25 years until I had it surgically removed last year. And let me just say, guys, ever since I had that stuff cut out of me, I've been a brand new man, and I feel amazing, and all I wanted to do was just help other men reach the same step. Now, I may not know how to make YouTube videos, I may not know how to talk, I may be an idiot, but I do know what it's like to suffer this condition, guys, and I generally do want to help and spread awareness and bring an end to this condition. So, if you enjoy this video, please like and subscribe so I can get a little inch closer to achieving my dream and helping as many men as possible, because this is a terrible condition, but it doesn't have to ruin us. Thank you. What is gynecomastia? Well, according to Cleveland Clinic, guys, gynecomastia is enlarged breast tissue in males. It's benign, so it's not cancerous, and it's an increase in breast volume due to an increase in glandular tissue. Now, to my understanding, all men have some degree of glandular tissue. It's just a matter of how much. Now, for gynecomastia, where we can see it, there is an excessive amount of glandular tissue, right? And that's how we have the grades. Grade 1, obviously being minimal amount of tissue, and going up to grade 3, where it's a lot of tissue, right? Like that's when we start to actually see a chest, a male chest that resembles more so a female breast. Now we heard from the experts. So let's move on. So how do you know if you have gynecomastia? Well, the best way to decipher it is just to feel it or look in the mirror. So glandular tissue, the growth is going to start underneath your nipple. Now you may have a thing called puffy nipples, which is what I had a bad case of myself, and that's where the tissue is just like really making your nipples protrude. But you can come underneath your shirt, find your nipple, go under, and squeeze. And if you feel a disc or like rubbery or a hard surface, and you can feel it move around, and you can feel it be an independent source from just chest fat, then that is glandular tissue. Again, another way, and what most of us can tell, is just looking in the mirror. If it's enough to bother you, you can probably see it. So, what is it, huh? Well, the causation behind it is quite simple. It's the imbalance of hormones, specifically when your estrogen levels dominate your testosterone levels. Now, theoretically, that could happen one of two ways, where your estrogen levels themselves are independently rising, where it surpasses your testosterone levels, even if your testosterone levels are within normal ranges. The second option is your testosterone levels themselves individually collapse, leading your estrogen as the dominating hormone. This is what causes the glandular tissue to engage in growth. And although I don't believe there's any real science behind my next comment, I do feel it's a logical assumption, and that is that the more imbalanced your hormones are, probably the more aggressive the tissue growth is. That seems like a logical thing to say, right? Now, gynecomastia most often occurs during puberty, and that's because we all know when our bodies are in puberty, our hormones are all over the place. There's a world of changes going on, and it's not uncommon for the scales to tip a little bit. What is uncommon is for those scales to remain tipped for too long. Normally, our body can recognize the imbalance and it can correct itself. And in many cases, children, I shouldn't say children, but teenagers, young men going through puberty will temporarily develop gynecomastia, but it is reverted by the body, by their own body, right? But that doesn't always happen. Now, you can still develop gynecomastia outside of puberty, and probably the second most common cause of that is steroid use. People playing around with steroids, not cycling correctly, not coming off their cycles correctly, crashing testosterone levels, raising estrogen levels. That can result in the development of gynecomastia. Also, maybe certain medical conditions, thyroid issues, any medical condition that can cause your body to function in a way it's not used to, that can cause hormone levels to change. And probably the third most common factor is medication. things like antidepressants, Adderall, even certain antibiotics can cause changes in your hormones, which any changes in your hormones poses the risk of developing gynecomastia. Now, of course, that doesn't mean a medication is dangerous, and men like myself who developed it are probably more sensitive to these side effects than most of the population. But there are many things that can cause it. But just understand that puberty is the most frequent one. I don't have any data on it, but if I had to throw a couple bucks at it, I would say that probably 90% of people develop gynecomastia during puberty, and maybe 9% steroid usage, and the remaining 1% medication, other miscellaneous things of this. So what can you do about it? Well, the answer to this question really varies on where you're at in your life in terms of age. So if you're a 14-year-old, 15-year-old, 16-year-old watching this and you're noticing some changes in your body, your best course of action is just to wait it out. Hope that your body fixes it, and it often does. That's the bright thing; it often does. You could also tell your parents about it. Go see your doctor. There is medication that doctors can prescribe to limit the growth, but of course that comes with side effects of its own. So that's a decision for you to make between yourself, your parents, and your doctor. Unfortunately, if you are done going through puberty and you have gynecomastia and it's bothering you, the only permanent solution is going to be surgery. And you'll hear a lot of alternative advice in terms of this category, but it's the truth. There's no good way to say it. There's no happy ending. The only way to have gynecomastia removed from you permanently is to undergo surgery. And it sucks, but that's the truth. Now, there's other methods you can do to remedy it, to eliminate it, to mitigate it, to hide it. And I will cover those in a different video because I did it my whole life. I've only been gyno-free now for 9 months, so all before that I was hiding it. And I will more than happily share my secrets, because surgery, there's a lot that goes into surgery, right? It costs a lot of money here in the United States. I would say $10,000 is probably the average for quality gynecomastia surgery. You also have to recover. You have to take time off of work. If you work a physical job, if you work in construction, if you lift stuff, that's more time you have to take off work. It's a big decision, and it's not easy. Look, gynecomastia, it can be confusing, it can be scary, it can be depression-inducing, and it can be embarrassing. It is embarrassing. Let's be honest. Let's not kid ourselves, guys. It is embarrassing. But the good news is it's common. You're not going through it alone. There's a world of men out there who have gone through it, who are still going through it. I've got it cut out of me, but I still haven't moved on. The trauma it's instilled is probably gonna be here for life. But the good news is, again, is you can remedy it.